Why would the government want the abortion rate up even further? In 2022, according to Minister Stephen Donnelly, more than 8,500 women attended abortion services in Ireland. That is an enormous jump in the abortion rate. Under 3,000 women travelled for abortion in 2018, with perhaps another 1,000 obtaining abortion pills. In 2019, 6,666 abortions were carried out, more than double the number of women who travelled in 2018. Then in 2022, another huge jump in the numbers, with Stephen Donnelly announcing that 8,500 women availed of abortion services. As Leo Varadkar acknowledged in the Dáil, that is not a small number.
There are 400 GP practices that provide abortion services in Ireland. That's not a small number. And over 8,000 abortions were performed in Ireland last year. That isn't a small number either.
8,500 abortions is an absolutely shocking number. And it's such a large number that it's perhaps hard to grasp really the extent or the magnitude of what's happening. That is the equivalent of 370 classrooms of primary school children who have never even had the chance to be born. It's a terrible indictment of our government's policy because they are absolutely failing women. More than double the number of abortions since 2018, and now we are seeing another jump of 25% in 2022.
We don't know what is driving the surge in the abortion rate because the government has adopted a deliberate policy of gathering almost no data on abortion beyond the raw numbers. They don't seem to want to know why women are having abortions, which is knowledge which might help roll out programs to assist women choose a different option or provide support in pregnancy. But even as the numbers described by some commentators as devastating continue to climb, abortion supporters are campaigning to broaden the law yet again. They are especially focused on the 3-day waiting period. When a woman seeks an abortion after the first appointment to confirm she is pregnant and determine the gestational age of the baby and other issues, the law says that 3 days must then elapse before the abortion takes place. This is seen by many as a time to think, a pause for reflection to avoid rushing into an irreversible decision. Yet groups like the National Women's Council, who have the ear of the government, want it scrapped. And last week, a bill by Breed Smith TD, which sought to scrap the 3-day wait and to legalise abortion on demand to 6 months, received support not just from Sinn Féin, but from Fine Gael TD Neil Richmond and Green Minister Catherine Martin.
A lot of women tell us that when they find out they are pregnant, their initial reaction is of fear and panic. And that is why that time to think is so important, because it gives them the opportunity to get the support they need and see past that initial reaction of fear and panic. And surely that's a good thing. Why would anyone want an increase in the number of abortions? Surely we should all be working together to reduce the number of abortions.
Data released to Cara Nolan TD shows that up to 4,000 women since 2019 did not return for an abortion after the 3-day wait. In 2021, for example, the state made 8,284 payments for initial consultations regarding abortion with GPs and clinics. But in that period, there was a much lower number of completed abortions, recorded at 6,683. That pattern was also seen in previous years, and many medics believe the 3-day wait helps women and should be retained. Recently, more than 100 doctors, nurses, midwives and other healthcare professionals, including consultants, obstetricians and senior medical staff in maternity services, signed an open letter strongly urging the Minister for Health to retain the 3-day period of reflection. They said that there is no medical basis for scrapping the 3-day wait and pointed to figures released by the Department of Health, which strongly suggest that some 1,000 women change their mind during that period of reflection and do not proceed with an abortion. The 3-day wait helps women, it gives them time to think, and the figures strongly suggest it reduces the number of abortions, Dr. Ronan Cleary of Doctors for Life has said. He pointed to the significant numbers of women who do not return for an abortion after the 3-day wait, saying a small number may have sadly miscarried, but it certainly looks as if the 3-day wait is leading to fewer abortions, something most reasonable people would welcome. Consultant obstetrician Dr. Trevor Hayes refuted the claim that the 3-day wait was paternalistic.
I disagree that the 3-day waiting period is paternalistic. If one gets any medical or surgical procedure, there is an inbuilt cooling off period where 3 questions have to be answered by the patient. 1, do I need this operation? 2, what are the benefits? And 3, what are the risks and complications? You need time, you need counselling, you need to reflect to make the appropriate decision.
So why would the government want to scrap the 3-day wait? The reasons given seem weak, including the claim reported widely in the media that there was no evidence it was helpful. The chair of the Abortion Review, Marie O'Shea, made the claim that there is no medical reason for the 3-day waiting period, and that research for the Abortion Review had found that women almost universally said they do not believe in a need for the waiting period. But then a revelation. When pressed on the claim by Peadar Tóibín TD, Miss O'Shea admitted that she had not spoken to any women who went through the waiting period and decided to continue with their pregnancy.
The state created a 3-day wait period for the specific objective of giving mothers an opportunity to make to weigh up the decision, which is a it's an enormous decision. It's an ending of a life decision. It's a big decision, and yet the report doesn't actually agree that any women have actually used the 3-day wait period to change their mind about proceeding to have an abortion and then have raised their children. Have you spoken to any women who went through that 3-day wait period and decided to go ahead and have their child?
No, I haven't. No.
It's a pretty stunning exchange. This is mostly the same government who promised voters in 2018 that the 3-day wait would be a safeguard in the abortion law. Voters will remember how Simon Coveney was sent out to reassure wavering voters that a yes vote would ensure a 3-day wait before abortion because the time for reflection showed the magnitude of the decision to terminate a pregnancy. Most of the media discussion around this issue focuses on the demands of abortion campaigners, but it's evident that some in Fianna Fáil and Fine Gael are hearing disquiet from voters about breaking the promises made in the abortion referendum in 2018. TDs are worried that they will be quizzed on breaking that promise, and senior Fine Gael sources have said that some members are worried that the recommendations could be seen as the party reneging on commitments they made during the 2018 referendum campaign, one report in the Irish media said. Last week, Fianna Fáil Senator Lisa Chambers said that the government had made a promise to the electorate in 2018 that the abortion legislation would not go any further.
I certainly, and many others, made a very big virtue at the time of that vote of presenting to the people what we would do as a legislator if they removed the 8th Amendment and allowed the Oireachtas to legislate. We presented the bill and we told people what we would do. And we made a promise on that day, I believe, that we wouldn't go any further.
It may come down to what abortion advocates in government feel they can get by voters, and a controversial broadening of the law might provoke an unexpected backlash. Doctors for Life said they urge the Minister for Health and our TDs to now remember the promises and retain the 3-day period of reflection. To do otherwise would be a betrayal of voters, but worse still, a dereliction of duty to mothers and babies, they said. And it begs the question, at a time when abortions are at an all-time high, why would the government take action to drive those already rocketing abortion rates even higher?